How do you prove diabetic neuropathy qualifies you for disability insurance benefits? Hi, I'm Mark Whitehead, a board-certified disability attorney and author of the disability help book, Disability Insurance Policies: How to Unravel the Mystery and Prove Your Claim. Almost 26 million children and adults in the U.S. have type 2 diabetes, according to the American Diabetes Association. And many of these people also suffer from peripheral neuropathy as a result of diabetes-related nerve damage. Neuropathy may become increasingly severe over time, causing pain, numbness, and weakness in the hands, feet, and other parts of the body, and eventually compromise an individual's ability to work and complete normal daily activities. If neuropathy makes it impossible for you to continue completing your normal functions of your job, you'll likely need to apply for disability benefits and prove that this disability is legitimately preventing you from working. The following forms of documentation will help you prove your case and receive the benefits that you need to support yourself. First, your medical records. The most obvious evidence you will need is your complete medical history, including a neurologist diagnosis of your peripheral neuropathy based on nerve testings, such as MRIs, nerve biopsies, blood tests, nerve conduction tests, or a spinal tap. Second, documentation of treatment. Presenting an initial diagnosis of peripheral neuropathy is generally not enough in a long-term disability case. You need to prove that you've continued the recommended course of treatment. If you can't prove you've received regular treatment from a neurologist or other medical provider, your claim may be denied. In order to prove that you can no longer work in the capacity that you used to, you need to prove that your neuropathy hinders your completion of basic day-to-day activities. The most straightforward way to do this is tracking how long it takes you to do certain tasks and what type of pain and other symptoms you experience while completing these daily activities. Things such as showering, dressing, and performing household chores. If you write all this down in an activity log, you can use that log as evidence. Finally, get a written statement from a neurologist. To make your claim even stronger, you should have your neurologist write and sign a detailed statement explaining the symptoms you experience, how those symptoms are disabling you, and what he or she recommends for your course of treatment. For more information on this topic, check out my free ebook, Disability Insurance Policies: How to Unravel the Mystery and Prove Your Claim. Visit www.disabilitydenials.com for a free downloadable copy, or call 1-800-562-9830 to discuss your particular disability issue. I'm Mark Whitehead. Thanks for watching.